So when we're looking at a full mouth rehab, there's a lot of things that we look at. And one of the main things that we look at is how you got here in the first place. Was it grinding? Was it your tooth? Was it your tooth position? Was there some kind of other factor? Was there trauma that caused it? And we have to determine what caused the wear that caused you to have these broken down teeth. Now, this is something that develops over time. It's usually caused by some kind of grinding event, tooth in the wrong position, and maybe your muscles, maybe it's your jaw joint. So there's a lot that goes on before even determining whether you're a candidate or not. Once we figure out what the cause was, then we go and we talk to the patient and let them know the procedure itself. And so once we determine the diagnosis of what caused this, maybe your jaw joint was out of position, maybe your muscles are hyperactive. Once we determine that, we put your teeth in a position and we do what's called a mock-up. We do a scan, photos, we send it to the lab, we do a mock-up, and we determine the proper position of your jaw joint, your muscles, and your teeth. And we do that through a series of ways. Once we determine that, we try that in your mouth and we see if all those muscles relax, if your jaw joint is fine. And then we also look at where your teeth are. We're making sure that the new teeth that we put in there, the temporaries, those aren't breaking down, those aren't cracking down, because those are going to mimic what your final teeth will look like. Once that's done, what we do is we will prepare your teeth almost exactly like the provisionals or the temporary teeth, and we will mimic those and deliver a product that's very similar to what you had in temporaries. So some key factors that we look at before creating a comprehensive plan for a patient is we look at if that was a good time in their life to address this problem completely. Meaning this person will continue to have this problem. Their teeth will continue to break down, they'll continue to crack, they'll continue to fracture. And if this patient's not ready to move forward with this treatment, then we don't talk about it. We address it. I let them know. We may put them in a night guard to slow down the breakdown, but not until they're ready to address it in full is where we can start. The other thing is a patient will often ask me, or patients will often ask me, if we can do one arch at a time. And oftentimes we can't do that. It's not the case, not to do it properly. Oftentimes you'll have to do the upper arch followed by the lower arch and do those at the same time, especially to match the bite. So those are two important factors. Now we can split up into days and we can do one day here, one day there, that's fine. However, when we're looking at doing the entire case, we do want to address it all at once because we want to solve that problem once and for all. So we don't want you to have to keep coming back because you're having broken teeth and something's off. It just doesn't work out right. So when we look at cosmetic procedures and we look at the function, oftentimes form follows function. So if we look at the form of the teeth and the position of them, the canines have a certain role in your mouth. The front teeth have a certain role in your mouth. They're designed different, they're shaped different, right? They look like shovels and knives, and so they're meant to chop your food down, whereas your molars, they're more like they're crushing something or they're designed for that. And so when you use your front teeth for crushing your teeth, let's say the position's wrong, and then you're using your back teeth to cut your food, what often happens is that you start to break down your teeth, and patients don't necessarily know that they're doing this because they've been doing this entire time. So for example, if they take a sandwich and they bite the sandwich and they leave the lettuce behind, they're putting too much pressure on those back teeth, and oftentimes those patients will eat out the side of their mouth. Or we'll have patients who use the front teeth to only chomp and chew because they have no back teeth. And so they'll wear those teeth down a lot faster. The full mouth rehab restores your entire function for your mouth to allow your teeth to bite properly, but also the cosmetics is aligned because once we put those teeth in a proper position, we not only take a look at the function behind it, but we look at how does that fit in your specific mouth, right? We don't want to put some big teeth on a little old lady and imagine how she would look there, right? So we want to make sure that it matches to the proper person, and we follow what's called the golden proportions, where it matches your face, your contour, your smile, your lips. And so we look at all that before doing the full mouth rehab. So patients who've been dealing with dental issues and dental problems for years, they may not even know that they were actually dental problems. Now, clearly, if your teeth are chipping, wearing, fracturing, and breaking down, then you're clearly going to understand that's from the dental issue, right? However, oftentimes patients will also have headaches, they'll have tension headaches, migraines. A lot of these are actually caused from your teeth not being in the proper position, which causes your muscles of mastication to not be in the proper position, which causes your jaw joint not to be in the proper position. All these three things are related. And when we're looking at a full mouth rehab, we put everything in harmony and we put it in its proper position. Once we do that, once everything's in harmony, a patient will feel relief from their tension headaches, their muscles of mastication, the grinding, because everything's in harmony at that point and you no longer have those issues. So the chipping, the wearing, the sensitivity, a lot of that stuff just goes away and you chew different, you hit different, and a lot of times when you see those headaches go away, the grinding goes away, and those issues that you didn't think were caused from a dental issue are solved from the dental issues that we that we that were solved from the dental problems that we've addressed. So somebody who has major dental issues like missing teeth or a misaligned bite versus somebody who has wear, those two processes are slightly different. One of them will require you to have orthodontics or braces. The other one we can get into the rehab almost right away. So when somebody has, let's say, a misaligned bite, it may take about 12 to 18 months in order for us to align the teeth in its proper position. Once those teeth are in a proper position, then we can go ahead and start the rehabilitation process. And if you're missing teeth, we're looking at either crown or bridge in order for us to restore those. And so sometimes we're looking at implants, and implants can take anywhere from 3 to 6 months to restore. So we're looking at that as well. So it's mostly time when we're looking at that. Now, if we're looking at a full mouth rehab and a patient has just worn down their tooth due to excessive grinding and wear, that's going to take a different approach. Where that approach, we're going to be able to, in 3 weeks, have that wax up ready to go, place it in the patient's mouth, and then start to rehab that patient right away. So within 3 weeks, you'll have your temporary teeth, versus the other one, it can take anywhere from 18 months to 2 years. So when it comes to full mouth rehabs, a lot of times what we'll do is, because these appointments are so involved, a lot of times we'll open up weekends for our patients and we'll come in on a Saturday to work on our patients. Or we'll have them as the only patient during that day. So I'm not having to get up and do hygiene checks. The other thing that we do is we offer different levels of sedation. So we have nitrous oxide sedation that helps you relax, which is laughing gas. We have a sedative pill if you need that. We also have non-IV oral sedation, where we give you a series of pills combined with nitrous oxide to help you relax. Oftentimes, patients won't remember the dental appointment because they're so relaxed. It has an anterograde amnesia effect, which means that after we give you the pill, you're not going to remember what happens after that, but you're still going to be aware. Meaning, if I ask you to open or close, you'll still be aware of what's happening during that time. It allows you to get through this procedure comfortably. And not only that, our office is equipped with dimming lights. We have noise canceling headphones. We have TVs, Netflix, Disney Plus, massage chairs, heating blankets. So we have a series of a comfort menu that we provide to our patients during this time, so they're as comfortable as possible during this procedure. If full mouth rehab can be done in stages or if it can be done in one go. The only time you can really do it in stages is if you're missing teeth and you're having to place implants. However, when you're restoring the bite, oftentimes somebody has grinded down their teeth so much that their bite has collapsed in on itself. And so if you work on one arch versus another, then the bite isn't restored correctly. So you have to do the top arch and the bottom arch simultaneously in order for you to get the proper bite, in order for you to grow that bite back. And what often happens is that if you don't do it at the same time, then what happens with those other teeth is you can break down those other teeth that you restored because you're putting too much pressure on those. So doing it at the same time is ideal. There are times where we've left our patients in long-term temporaries until they are able to afford the rest of it. That way they're not breaking down their teeth. It's possible to do that, but it's not ideal. It's not something I would recommend, but it's something that is possible. So the most rewarding part is when somebody restores their entire mouth. They've been suffering from this for years. A lot of times they had no idea their headaches, their jaw joint pain, their issues were coming from their smile or their bite. So one is the relief from pain. Um, is as soon as they're relieved from pain, they're just happier. Two is restoring their confidence, knowing that those teeth, once we put them in there, they're never going to stain. They're always going to look the color that we deliver them, whatever color we decide. And you never have to worry about whitening or bleaching after that. Those teeth won't stain. You'll be able to brush, floss, and clean them regularly, and you'll be able to chew and eat whatever you'd like. So you get the function back, you get your aesthetics back, you get your confidence back, and most of all, you're a lot of times you get your pain is relieved as a result of it.